In the last few sections, we discussed how change itself is changed. From algorithmic to logarithmic, from industry 4.0 to healthcare 4.0, we discussed the different challenges in healthcare 4.0, how the digital transformation will look like in healthcare 4.0. This is sort of a reiteration, but I really want you to drill that subject in your mind, because we truly live in an age of deceptive. The word deceptive means that it will creep up without you even understanding what happened and what this change happened. So deceptive, and it's going to be utterly disruptive. And let's just take some few examples. So as far as information is considered, we have a massive change in terms of how we acquire knowledge. I mean, Google is built on an artificial infrastructure, which Yahoo has replicated, Baidu. We have information that is now open access, that is available for all, like Wikipedia and digital publications are the mainstream as compared to before, where publications were behind significant paywall. And it was not just about paywall that is the problem. I think we should have paywalls. The issue is, at this point in time, is that accessibility. Now there is global accessibility to information. Any new article research, any new books that are now globally available to everyone forever. And therefore, the amount of information that is disseminated is significant. That in itself creates more possibilities of increasing your knowledge that can be global in impact. So therefore, extremely significant disruption in the way knowledge and information travels and how fast it travels. Let's talk about communication, right? I mean, I can't believe how easy it is to communicate at this time and age. I mean, when I first moved to US, I had to pay $1.50 for a minute to call my homeland Pakistan. Now it is for free forever, and it's just not audio. It could be video and audio, and it's just not video and audio. It is multi-party video and multi-party audio, and it is all for free. We used to rely on emails, and email is still significant. I think it's about 4 billion emails per day. And we're going to talk about these statistics as well when we move along, because this is a major source of data that we go, and the significant ways that we can communicate now. And more importantly, we can organize into communities. We can have communities that can be very, very passionate about a single subject. For example, digital health has significant communities. I'm part of a few of them on LinkedIn and Facebook. So not only we can communicate, we can actually participate and engage in a more meaningful way that creates, again, more data, and not only more data, more applicable data that actually people can analyze that, hey, Dr. Kalea is interested in, he has this experience, why is he, and those clicks are more important, etc. And it's already being done. So communication, engagement, collaboration. Retail, we talked about Amazon, Alibaba, eBay, JD.com. These are completely sort of a brand new platform, right? I mean, even if you think about it as 20-year-old companies, I mean, Amazon is 20-year-old, Alibaba is a little less. Even so, if you consider that with Walmart, which is 60 years old now, the amount of disruption they have produced and the pinnacle of financial strength they have achieved so much faster than Amazon, than Walmart had to achieve, is amazing. And again, it's extremely disruptive. And Walmart is now rethinking its whole approach completely as compared to what Amazon did. And this is the disruptive, more so deceptive nature of this change itself. Entertainment, we talked about iTunes, Netflix, YouTube, right? I mean, this is probably you're watching it on YouTube or one of the similar platforms where this video is going to be distributed in a way that anyone can be able to benefit from this knowledge. Same thing with travel. We are able to significantly decrease waste, empty plane seats. We can have a sharing type of economy like Airbnb and Uber. Amazing, disruptive, deceptive change. And finance. Boy, it was so hard. It was so expensive to send money around the world, and now with decentralized finance, it's called DeFi. And with the advent of cryptocurrency, mobile banking, and availability of these services has decreased the cost so much. Remember the demonetization I told about? Here are the few examples. More importantly, now it is going to be more secure with cryptocurrency at its back end. I'm not talking about Bitcoin, I'm talking about blockchain as a technology that will have more security, even though as compared to our current banking system, and will eventually create what we consider programmable money. So therefore, this disruption is still in the making. And of course, two of the most disruptive industries I am most excited about. Number one is education. As you can see, we're talking about edX, Coursera, hybrid and modular ways of getting education. Executive education has already changed for the past 5 years, right? I mean, if anyone is gonna look at it, executive MBAs, etc., has always been online, partly on site, and geared towards busy professionals, always had these facilities. Now, those same characteristics are now available to everyone. And to be honest with you, from the best teachers, right? Coursera is not getting all these amazing courses online like Andrew NG has produced it on deep learning. So it's amazing to learn from the best at your pace on your own time for a significant less money. Disruption, deceptive. Same thing with healthcare. BMed has been the innovative company for the last year. We have added multi-party language support, and clearly Epic and Cerner has made some advances as far as Epic EHR management is concerned. Optum is one of the best healthcare exchange network, has improved data capabilities for many organizations. IBM Watson and other artificial intelligence is going to improve, in this particular case is oncology, but again, all in all, these technologies are going to transform healthcare, and it's already doing it. And it's going to continue to do it. And this is where AI NeuroCare comes in. It's basically a dissection of education and healthcare. We want to make sure that we provide the disruptive education for the disruptive healthcare that is in the making. Now we're going to talk about the real mind shift behind it, the real essence of human behavioral change that is going to continue to make sure that these changes are not only adopted, but accelerated in its adoption. And that is where I'm talking about cultural shift. Now, human beings are really hard to change, believe it or not. People have done a lot of studies on how to actually make sure that a change is managed. And there's a whole field of change management. You know, some of those articles from Harvard Business Review are very fantastic to learn about it, including the kind of framework, which I'm not going to share here, but again, if you're interested, feel free to read about it. This cultural shift, this mindset shift that is extremely important to create a disruptive, deceptive change is important. And we are living through a cultural shift in the making. Now our education is online, our work is online, and our clearly healthcare is getting online. This cultural shift, when a majority of our life is remote / digital / online, is a significant change. And we would think that this is just temporary because of the pandemic, but that's not true. I mean, this is my daughter who's actually doing tele-karate lessons while in the midst of the pandemic. I wouldn't have thought that, you know, karate would be taught over an iPad, as in this case. It is interesting to see that shift, and she enjoyed it. Of course, we're going to send her back to an actual karate class, and I'm not saying that this is something she should continue. But that shift is extremely important. This is the shift that we are looking at. This is the Generation Z. We have seen a complete shift from TV to laptops, now to smartphone first. What we're seeing is a generation that is mobile first, that is smartphone first. This particular digitization of interaction, this in itself, the change of the way we culturally accept and propagate to our peers the digital transformation of our interaction in itself is a significant mindset shift. And this is changing as the population dynamics are changing itself. So as we move from baby boomers to Generation X to millenniums, and now Generation Z and Generation Q, which is the quarantine generation, we're going to see this shift accelerating, and then their expectation of anything, period. I mean, my daughter continuously, she's 5 years old, and asked me, okay, have you done this download, or can we order it on Amazon? Which is interesting at the age of 5, that she could actually have all those sort of knowledge that her expectation of experience is digital first. And as you can see, as we are moving through this processes, the way we are actually approaching reimbursement of these services are now in an ad-free, on-demand subscription models. And as you can see that the subscription model is continuing to be the basis. I mean, previously I used to always buy software, and then there's a major update release, I'll buy that software. But now most of the software that I've been using consistently is on a service model. That means that it's a monthly subscription fee that I pay for these softwares, and there's a constant update, including security updates. And this is the same model that we are seeing in the business class, as I have to. I mean, there's clearly no other way around it sometimes. And then of course, most of the places where we do education, learning, etc. as well. So what do you think? Will the healthcare model be a subscription model? I mean, it is sometimes. Believe it or not, what is insurance at the end of the day? You are basically paying a monthly premium. But where you're going to see the difference over here is that that will be more enhanced by artificial intelligence, and we're going to see that this digital transformation is going to bring more value to the current healthcare segment itself. And we're going to see direct pay and subscription models in direct pay. So those are like physicians directly contracting in the cloud to the patients, and where direct pay arrangements are made, that will also go towards what we call concierge medicine. In this particular section, I want to emphasize that at least in healthcare, it is only the beginning when we're going to see the digital transformation. And why do I say that? If you really look through that, the pandemic actually provided the necessary acceleration of virtual care. I mean, it was increased by 50 to 175 times what it was used prior. As a matter of fact, we're seeing that about 75x is where it's going to basically come back to. So in short, from pre-COVID levels, virtual care is now 75 times, and that is going to be the new baseline. So significant increase in the virtual care proposition. Why is that important? Like, why do I keep talking about virtual care? Well, the reason is that the virtual care, the telehealth, is the key to the digitization of the front door of the healthcare. The minute you enter the clinic, if that clinic is virtual, then the whole building, the rest of the building will get digitized. So if you really want to ever actualize digital transformation of healthcare, then you need the front door to be digital. And if the front door is digitized, that is the key for digital transformation, which is telehealth virtual care. And this is truly a paradigm shift in healthcare delivery. I call virtual care a gateway drug to digital health transformation. So clearly that is so important. That is such an important key to the rest of the transformation. And this will lead to what we consider a complete shift in the care environment. Why is that? So these statistics are coming from the United States, and those who are not from the United States, it will be a little shocking to hear that. We only pay 5% of our healthcare costs to primary care, which is wrong. And acute care is a significant portion of what we are providing care for in terms of money. However, massive amount of care that is actually currently being provided is 15% is going into acute care, urgent care, ER visits, etc. That virtualization will increase the preventative care and decrease the cost of care in acute settings. That in itself is going to change the actual need for the number of hospitals that we need. It's going to go to decrease. And ambulatory care is going to go up. Home care is going to significantly go up. But how? We're going to see the virtual care continuum where telemedicine is going to turn into telehealth, and telehealth is going to turn into digital health. We're going to see the birth of virtual hospital at home, where literally we can provide a lot of even acute level services at home. And home care is going to become a new care facility. And that change in itself is going to decrease costs significantly. The actual hospitals that are currently there are going to become smart in nature. Now, clearly you need to have more resources. So these are a collection of resources that I think everyone should watch or read or listen to in their own time. The first and foremost is the book Industrial Revolution by Jeremy Rifkin. This is the YouTube video by Weiss, which a direct link is shared in the Academy website. And you should for sure also read this book, The Third Industrial Revolution. Some people call it Third Industrial Revolution or the Fourth Industrial Revolution. Whatever you want to call it, doesn't matter. This actually really, truly make you understand where a radically new sharing economy comes in. Things like Uber and Airbnb, the genesis of them, and how we're going to continue to move towards that into a global sharing economy. Very fascinating read, and then more importantly, make sure you watch that video. And I'm grateful to Dr. Rifkin for improving my understanding, so thank you. Same thing, this book, Kevin Kelly. I mean, he's a significant writer. 12 years ago, he wrote the book about internet and how it's going to change. And now it actually wrote about 12 technological forces. And the way he goes into it, it actually goes from a skill to skill level. So it doesn't really just talk about AI. It talks about different skills and then explores into it. So clearly, very important. I think this should be a reading for every high school student. And please make sure you actually go ahead and read the book. Now, Charles Schwab, The Fourth Industrial Revolution. He is actually the founder and the chairman of the World Economic Forum, who basically wrote a textbook on the Fourth Industrial Revolution. Please make sure that you put that in your reading list moving forward. And this is the key book by Peter Daniels. The 5 Ds that I talked about, demonetization, decentralization, democratization, etc., comes directly from this book. The future is faster than you think. He's also the creator of the Singular University, so I have really brought into significant talent for making sure that we are understanding the changing world. His prior book was Abundance, which is also a great read, but this, in my opinion, is sort of an update to all the prior ideas and now into a new book and this title sums up basically what I've been trying to say. The future is faster than you think. How convergent technologies and transforming business and industries in our lives. Fantastic read. Make sure you actually either listen to it or read it, whatever your preference is. This is the care model that I shared. It is actually application of Industry 4.0 to the concept of Healthcare 4.0. Again, the reference is shared into the Academy website. This is an open access, so everyone can access this journal. So make sure that you definitely read this article. And the real essence over here is you have learned all this, and you know change is changing, and you now understand Industry 4.0 and Healthcare 4.0. But how will you respond to it? Now you know all that, and it's sort of overwhelming at the point, like, what the hell am I going to do? And how am I going to be able to respond to this significant amount of pace in change, right? Not just change. I mean, responding to change is one thing, but how do you respond to a pace of change that is always changing? So that's sort of a new breed in terms of skill level that we have to look into. This work is extremely important by Michelle Walker. It is called The Grey Rhino. I don't know if you've read Black Swan by Nassim Taleb. That actually defines like once in a century in which the pandemic is. What she has actually puts it all over to the head and says we don't really need to look for a black or a white rhino. All rhinos are gray, and we have to make sure we always look for the gray rhino. What she means by that is that we should take these important changes that are happening in front of our eyes seriously, like climate change, which is basically causing pandemic in her opinion, and etc. and mine too. But what I'm saying is that this is an essential book to understand and make sure that you understand the constant nature of change itself and recognize and act about it. Because if you're not going to recognize it and act on it, then this all knowledge is lost. Interestingly, this book has been a bestseller in China as compared to in US, which tells us that how important they take these changes, and unfortunately we are not, in my opinion, as a society taking that much seriously. Anti-Fragile. This is the Nassim Taleb book. This is again a mindset book in which is different from that. The word fragile means that easily breakable. Anti-fragile is different than being concrete or being unbreakable. Anti-fragile is a mindset in which you are able to absorb, act, and react to changing environments more fluidly. This is also creates a mindset in which you are able to emerge more better from the disaster that you have faced. Another thing that we're going to see that some of the things that we are seeing, the constant disorder that we're seeing in healthcare and the constant change, this could be an opportunity, this could be a gain, and how we have to constantly improve in that digital transformation moving forward. So fascinating book, again a mindset book. Make sure you put that on your reading list. And these mindsets are going to be extremely important moving forward. You will need an anti-fragile mindset to understand the coming acceleration of change. This is one of my favorite books, Ultra Learning. This is really fascinating. This is actually breaks down how you learn fast, and it helped me a lot personally. I'm not going to get into it. You should just put it on your list and read it, period. This is actually from McKinsey, which is a fantastic global consulting firm. And in that, just heading itself is amazing. The most fundamental skill that is going to be important and needed for the future is intentional learning. Even if you become a doctor, you have to do constant learning. Even if you have constant learning after fellowships, and even in your profession moving forward, and no matter what your profession is. If you're a car mechanic, I mean, there are new models coming out every day. You need to learn constantly. And the way you do it is you make it intentional, you make it a habit. And then you set small goals and you have clear goals. I'm not going to go into all this. This is something that other people have done, super learning, etc. But this is actually a very fundamental, excellent read. I've added it into the resources as well. Now, intentional learning as a habit. It is so important that you understand that not just changes that you do outside, for example, these changes and that is happening. If you make small, consistent changes in your habits, you can have major compounding return. So learning as a habit is extremely important. And James Clear in this book dives into it, that how habits make you successful. So an amazing, important book that you should always read and reread. To be honest with you, this is one of those things that I take a summer and reread some of these books, and this book is one of them. Boy, this is, to be honest with you, should be part of every education curriculum globally. This is what is considered mindset of prioritization. We're going to realize that about 20% of effort leads to 80% of the results. And if we can just concentrate on those 20%, we can significantly change our stress levels and our output and productivity. So this 80-20 principle is extremely important as a mindset concept for everyone to understand and learn. Make sure you put that on your reading list. With all these changes that is happening and the pace of change is accelerating, it is more important than ever that you actually understand the importance of doing the right job as compared to just doing the job right. You're gonna be in this particular subspecialty for 30 years. It's gonna be a multi-million-dollar career. So at this moment in time, you really need to be insightful, have a vision, make sure that it aligns with your passion and your profession. So therefore, choosing the subspecialty is more important than ever.